Hi guys, Dr. Blackett with Yada Yada Health. Today we are talking about preeclampsia and if you are at risk. The first obvious question is, what is preeclampsia? And it is a little bit hard to explain. If any of you are Downton Abbey fans, then you probably remember the episode with Sybil, and she was pregnant, and the doctors were arguing about what was going on with her, and she actually did have preeclampsia. Her blood pressure was high, there was protein in her urine, and it progressed to eclampsia, which was seizures, which can be a very bad thing. As any of you who watch the show know, Sybil did not survive that encounter. Luckily, with modern medicine, we're usually able to catch any kind of preeclampsia before it turns into any badness, and we can treat it and usually have very good outcomes. So preeclampsia is usually increased blood pressure with signs of damage to certain organs in our body, which might include your liver or your kidneys, or sometimes even your brain. It can be very serious if left untreated. How do you know if you have it? Well, this is one of the important reasons to make sure that you are going to your prenatal visits. At your prenatal visits, your blood pressure will be measured, and generally after 20 weeks, we start checking your urine every time you come to look for signs of protein. If we see anything that's concerning, then often we'll do some blood work, or we may ask you some more detailed questions about how you feel. With preeclampsia, you can get a lot of swelling, you can get some headaches, and some vision changes. Now, in pregnancy, in fact, in most pregnancies, we get some swelling. So swelling by itself is not a good indicator. But swelling associated with high blood pressure and protein in your urine is an indication of preeclampsia. I mentioned some vision changes. You can get those as well as some upper abdominal pain. So if you're having any problems like that, be sure to mention it to your doctor. What are some risk factors for developing preeclampsia? Well, there are many. If you've had preeclampsia before, then you are at risk for having it again, although it's usually much more common with the first pregnancy. If you have a history of hypertension or high blood pressure when you're not pregnant, then you're at risk for developing preeclampsia. If this is a new father of your baby compared to your previous children, then sometimes we'll see preeclampsia. Your age can be a factor, as well as your race. If you're having a pregnancy with multiple gestation, meaning twins or triplets, or if it's been an infertility pregnancy and you had IVF, those are all factors that can sometimes predispose you to preeclampsia. When should you see your doctor if you think you have it? Anytime you have any of those symptoms, you should follow up. We'll usually have you come in the office where we can check your blood pressure and your urine and perform an exam to see if anything serious is going on. What will happen if I have preeclampsia? Well, it depends really on what point you are in the gestation. So gestation, remember, is what point you are in the pregnancy. If you're very early and we're concerned about a premature baby, depending on how sick you are, then we may actually watch it. There have been more studies of late that have supported being able to watch preeclampsia if we limit your activity level, if we have you rest, if we're able to keep your blood pressures down in a good place. But it really depends on how sick you are. And it would require often staying in the hospital and monitoring the baby frequently. If you're usually within at least a month of your due date, when you're diagnosed with preeclampsia, then the cure is delivery, and we often move that direction. If I have preeclampsia, does it mean that I have to have a C-section? Not necessarily. If everything's going well and the baby is doing just fine, then we can usually induce you and try to have a vaginal delivery. If you are very sick or there's signs that the baby is not doing well, then you may have to have a C-section. Do I need to do anything different in future pregnancies to prevent preeclampsia if I've had it before? They actually have some good studies now that support the use of low-dose aspirin taken daily during pregnancy to help prevent preeclampsia. So if you've had that history in your previous pregnancy, be sure to bring that up to your doctor or your midwife or whoever's managing your subsequent pregnancies, and they'll likely recommend that you take that daily aspirin, 81 milligrams, every day during the pregnancy to help keep it away. Thanks, guys.